The pricey offices of downtown Vancouver show no sign of the toxic drug crisis or addiction because successful careers make it easier to hide.
Kind of living a double life, in the boardroom one morning, working with a client, media training them, or, working with them on a strategy, and then on the downtown east side, later that day.
Rachel Thexton went to treatment several times before the business owner was prescribed Suboxone. The opioid substitute satisfies cravings without the high.
A mixture of that harm reduction with therapy really changed things for me.
Harm reduction is shorthand for policies aimed at illicit drug users consuming an unpredictable stew of chemicals.
People we know who are dying at home alone.
There are clean needles and free Narcan. A few thousand British Columbians are prescribed safer supply drugs that must now be witnessed by a health professional. For those finding their own street drugs, dozens of temporary overdose prevention sites are overseen by health authorities and staffed by peer support workers equipped with the overdose antidote naloxone. A handful have prompted complaints and even lawsuits.
Crime, human feces, just disorder, yelling, people, in distress.
There are also long-term government-run and funded facilities.
We've been really able to kind of evolve the model that we started here at Insight.
Insight was North America's first supervised consumption site in 2003 and brought down overdose rates until fentanyl arrived.
The problem is not just in the downtown east side now, it's in other neighborhoods of Vancouver, other parts of BC, and the crisis around mental health and around addictions also intersects with the crisis around affordability, housing.
Some parents find themselves on opposite sides of the issue after the death of a child.
Why is that the one drug in our system that's supposed to be safe supply?
Representing loss to some and life-saving measures for others.
People have become more afraid of harm reduction.
If Narcan wasn't available, if overdose prevention sites weren't there, and I wasn't safe when I had relapsed those times, my kids wouldn't have a mom.
In light of the public health emergency, many police leaders, healthcare practitioners, and elected officials stand behind policies that keep people alive until they're ready for treatment. In the next installment of this series, we look at a new era of recovery in BC that starts with one phone call. Penny Daflos, CTV News, Vancouver.